I know everyone is exhausted by now, so I will try to make my presentation as short as possible. I'm going to discuss infections in HIV patients. I have to thank Dr. Faya before my presentation starts because she helped me a lot. Okay. Why infections in HIV patients specifically? Though we all catch infections, of course we do, because organisms are all around us all the time. But we have a normal healthy system that keep these organisms at bay to prevent us coming ill. But in a case of a patient with HIV, these organisms take opportunity of the weakened immune system and they cause that person in many infections as we will see now. So does any patient with HIV get infections? The answer is yes and no. The answer is yes because as we all get infection, this person can get infection. But no, before answering this question, we have to throw a look quickly at the stages of HIV infection. As Dr. Faya has said, we have the primary infection, then the latency, and then the two stages in which I'm concerned about. The first one is the age-related complex, in which the CD4 count is from 500 to 200 cells per mm³, and the other stage is the age stage in which the CD4 cells are below 200 cells per mm³. So what's the difference? The difference is in the R phase, the patient gets common infections. And in the age stage, the patient only gets common infection in addition to the opportunistic infections. So what's the difference between common infections and opportunistic infections? The difference is that common infection can occur to us, but in the HIV infected patient, they are more severe, they are more frequent, they respond poorly to treatment, and again, the person will take some longer time to recover from this infection in comparison to a normal immune system patient. Opportunistic infection occurs only in immunodeficient person as patient with AIDS. Okay, I would like to share this story with you. It's the reverse pathway. How did the opportunistic infection lead scientists to the discovery of AIDS? The story says that we as physicians discovered two gay patients having severe infections and manifestations from low virulence organisms. And by checking their blood profile, they had no CD4 cells, and that was the beginning of the discovery of AIDS patients. Small knowledge we have to share is that immune deficiency in HIV patients starts in the cellular immunity, and that's why the beginning of the infection is in the organism that needs cellular immunity to be cleared as the viral, fungal, bacteria, as TB. Now let me share some examples of these infections. As we said earlier, we are going to classify this infection into common and opportunistic infection. Some common bacterial infections are TB, and this is 40 times more common in HIV patients than in a normal immune system. Opportunistic infection include Mycobacterium avium complex and Listeria monocytogenes. Mycobacterium avium complex may cause infection to the spleen, to the bone marrow, and this may be fatal. Viral infections include common infection, opportunistic infection too. Common infection like herpes simplex virus, mainly the genital type, herpes zoster virus, and the characteristic feature in AIDS patient is that it is a multidermatomal affection. Human papilloma virus causing genital warts. And lastly, molluscum contagiosum, causing molluscum contagiosum lesions. The opportunistic infections include cytomegalovirus virus infection causing retinitis, enteritis, and pneumonitis. And pneumonitis is the cause of death in this infection. Epstein-Barr virus causing hairy leukoplakia. And finally, the GC virus causing progressive multifocal leukoencephalopathy with change in size, speech, and sometimes personality. fungal infections. The common infections include Candida. It's a commensal and it helps to regulate the common organisms we have in our body, but in AIDS it turns crazy actually. Where this balance is disturbed, Candida overgrows other organisms and it causes many infections, including oral infection and vaginal infection. Opportunistic infection include cryptococcosis and pneumocystitis jirovecii causing pneumonia. Parasitic infections include common infection like toxoplasmosis and opportunistic infection, cryptosporidium and ozosporiasis causing diarrheal diseases. Lastly, this is the last message I have. Why I'm concerned too much about these infections, because they are the real cause of death. The cause of death from in AIDS patients is not the infection by HIV virus itself, but because of the opportunistic infection that take opportunity of the weakened immune system. So prevention of these infections is very important.